So for areas of concern, we wanted to cover shortage of PPE due to COVID-19 and non-compliance of healthcare workers to wear the PPE. So obviously we know that PPE is used to protect healthcare professionals from infectious patients, materials, toxic medications, and other potentially dangerous substances. And since this virus spreads so easily, it's really important for everyone in all settings of these facilities to be protected. So this leads to a smaller supply of the PPE since we're using so much of it. And the facilities are either stressed on supply, they're running low, or they're just completely absent of PPE. And it's really hard for the smaller facilities, like in rural areas, to receive this PPE because the bigger hospitals who have more cases and it's a lot more serious get the shipments before them. And then, so since this is happening, facilities are beginning crisis capacity strategies. And since we don't deal with crisis that often, such as this pandemic, the effect of the strategies is uncertain and may pose a risk to the providers and the patients. And the picture kind of shows each country and their PPE supply and how long it will last them. For non-compliance, as I said before, it's very important for providers to wear PPE to protect themselves. And unfortunately, some healthcare workers just choose not to wear it at the appropriate times. I'm not really sure why, but 89% of safety professionals said they observed workers not wearing PPE, which is a lot. And 29% said that this has happened many times. And the data from the Bureau of Labor Statistics shows that a vast majority of on-the-job injuries were due to the workers not wearing PPE. And the reasons for their non-compliance have been because the PPE is too uncomfortable, it's too hot, it's a poor fit, or it's not available, or it's unattractive looking, which is a bad reason in my head, but that's just me. And then, so obviously we also know that when they do not wear this PPE, the health of the patient can be a lot worse.